Welcome to Nursing the Nation, the podcast where we dissect today's headlines, current events, and hot topics through the uniquely insightful lens of our nursing expertise. I'm Jamie Bourgeois, a midwife and psychiatric nurse practitioner.
And I'm Melissa Ann Dubois, an experienced perinatal nurse. We are both nursing PhD students, and together we use our nursing expertise to break through the jargon and political noise to explore the human element of current affairs, providing a grounded and compassionate understanding of the issues that impact us all.
Because when it comes to understanding the pulse of our society, who better to ask than the most trusted profession? Hey everybody, today is part 2 of our series decoding the Make Our Children Healthy Again. So this is what nurses want you to know. Last episode, we weeded through the topic of diet and ultra-processed foods. That was mentioned as one of the reasons for how unhealthy Americans are, or our children, although I could say all of our citizens. And we hope that you went and listened to our first episode, but if you have not, go back and take a listen. And today we're going to be discussing the cumulative exposure to chemicals like food additives and pesticides.
That is right. So the MOCA report, as I'm going to be calling it, which is Make Our Children Healthy Again, there's 4 points that it makes. And the second point is about the cumulative exposure to chemicals like food additives and pesticides. So what does MAHA claim? MAHA claims that children are exposed to a growing number of synthetic chemicals like PFAS, microplastics, heavy metals, pesticides, etc., through food, water, and air, leading to potentially long-term health effects, including neurodevelopmental and endocrine effects. They also note concerns about the cumulative impact of these exposures over time. So, what does MAHA propose to do? Well, this MOCA report calls for more research into the cumulative effects of chemical exposure as a shift towards policies that reduce exposure to these chemicals, including tighter standards for pesticides and packaging materials in food systems. The report mentions that 50% of non-industry funded studies found common pesticides that we use in our country as harmful, while 100% of industry funded studies before 2005 deemed things like BPA safe, which has BPA is a plastic that's since been, removed from like baby bottles and water bottles and things like that.
Yeah.
So that is the MAHA, proposed claim in action. What does the scientific consensus from the scientific community basically say? The reality is that scientists mostly agree that children, are vulnerable to environmental contaminants, and the cumulative exposure is a valid concern. Regulatory agencies like the Environmental Protection Agency and the Food and Drug Administration have historically monitored and set limits for pesticides and chemicals in food and the environment to protect public health. I say historically because we're going to get to why this might not be the case anymore.
Yeah.
Research into the health effects of emerging contaminants like PFAS, which is a forever chemical, they call it. It used to be found in things like firefighting foam that was sprayed on fires and then can leach into the water supply, other microplastics that can be leached into our food, especially food that's packaged in plastic or, for example, microwaved in plastic.
Yes.
These are things that are, research is ongoing into these things and generally taken seriously in the scientific community. The scientific community, pediatric experts, nutrition experts, they are generally in consensus that, children especially have developing bodies. Their organ systems are still maturing, making them more susceptible to disruption, like endocrine disruption and things like that.
Mm-hmm.
Children also have a higher intake of these chemicals relative to their body weight. So, if I eat an apple that has pesticide residue on it, I'm a bigger person that's, 160 pounds, whereas my, 40-pound 5-year-old, she's going to have the same amount of pesticides, but in a, 40-pound body, right?
Mm-hmm.
And then there's unique behaviors in children, like hand to mouth behaviors, aka sticking everything in their mouth,
Oh,
that
yes.
increases their exposure to substances in their environment, right? Things that are, dust and dirt on the floor and, just putting everything in their mouth. My kids, I'm driving down the road the other day and they've got the water bottle in their mouth. I'm like, gosh, can you just like stop putting everything in your mouth? So that is basically what the, scientific community is generally in agreement with this.
Hmm.
So where's the problem, I guess, Jamie? So why don't you start? What are
Uh,
some of your concerns about this tenet of the MOCA report?
I think, when I was reviewing this, I looked at this, and I think this is coming from, our my recent classes in learning how to, excuse me, how to, critically appraise scientific literature. And
Yes, that's a
so,
big part of what you do when you're a PhD student is
yes.
actually learn how to conduct research and critically appraise it. And you realize how much you didn't know when you're
Right.
learning that.
And you thought you knew kind of how, as nurses, just generally, you thought you knew how to read like a scientific report or paper
Hmm.
that's published among, like the literature.
Hmm.
Um, and I think my take on a lot of how this information, while rooted in an an actual problem, went very sideways. Like it took like the wrong turn into
Hmm.
its trying to prove its point. And so it was very clear to me, like the goal here is meant to protect children from chemical and pesticide exposure. And, it also reads very clearly to me that it isn't just that, like the PFAS and the microplastics, which is a very, I think, well accepted problem
Sure.
among, what I'll call mainstream science,
Hmm.
not kind of the fringe, science that might be out there. But and I will say actually the PFAS, and particularly in my neck of the woods, I live in southern New Hampshire, has been of a big priority. We had a manufacturing plant that manufactured PFAS, and guess what?
Oh, did it get into our environment,
Oh,
Jamie?
sure, it sure did. So, in New Hampshire, there not everybody is hooked up to like town and city water and sewerage. So,
Sure.
for instance, this one local town has a lot of homes that have wells,
Right.
and um, there's not a lot of regulation around what your wells have to be like,
Hmm.
but people who can afford to test their wells were noticing this trend of PFAS in
Right.
their well water. So it became a very big thing around the same time like this. More information in the media about microplastics. So, I definitely think that these are things people are concerned with, and definitely would agree with the science that's out there. So again, getting back to, I think the goal and kind of the focus on some of this is spot on. But when I really was digging into how they, where they were getting their information, the references that they were pulling from, it, really was where things were going kind of in the wrong direction, in my opinion, where like they were heavily focusing on how terrible fluoride is.
Hmm.
And I was, looking at that like, okay, well, I know that there's some controversy about fluoride, but is that really where a lot of this effort needs to be put, as opposed to more of the microplastic and other forever chemicals that we are exposed to? Um, the other thing that seemed hard to take, because as soon as like I'm the type of person that like as soon as I see like, oh, I see you're grounding your beliefs or your argument in something that is just so like out there
Hmm.
or not accepted as, you know, good solid science or what have you, it's hard for me to like buy on to the rest of what you're telling me.
Right.
And so in particular, when it comes to their arguments of exposure of these things to kids, they were using some data and information from the American College of Pediatricians. Now, That sounds like a really legit s- professional organization, doesn't it?
Yeah. Yeah, yeah. And in
Okay.
fact, as a nurse,
Yeah.
my thought is, wait a second, I thought it was the American Academy of
Aha.
Pediatrics, right?
Aha.
So what is the
Yes.
American College of Pediatrics, Jamie? Or
Yeah.
pediatrician?
So they are the American College of Pediatricians is a professional organization, is meant for pediatricians, and I believe other healthcare providers that specialize in pediatrics. So
Okay.
I think they might be an organization that accepts like physician assistants and nurse practitioners, but don't quote me on that piece.
Hmm.
But anyhow, they were founded in 2002, I believe, and they are rooted in very conservative beliefs. They have been designated as a hate group from the Southern Poverty Law Center.
Oh, interesting.
The American Academy of Pediatrics, which is what most people would recognize as the professional organization of pediatricians, has also spoken out against this group. And I think it's pretty misleading um, that you're trying to make an argument in which I think most people would agree the goal, we all share this goal of protecting, people and children from these harmful chemicals or potentially harmful
Sure.
chemical. But then to turn around and say this is why and give these um, fringe groups that have a quite literal hate group designation
Right.
as your citation makes me very nervous of the direction of action.
I agree completely. And,
Yeah,
and that's only one criticism of
right,
the resources that they
right.
cited in this report. Again, we're
Oh
saying
yeah.
here that the general mainstream scientific community agrees that we should be limiting exposure to chemicals and pesticides and forever plastics, to our children. They agree. And yet the references in the
Hmm.
MOCA report cite like these fringe, relatively new organizations of professionals that are designated as hate groups
Yep.
or blatant, like made up, like
Hmm.
artificial intelligent hallucinating references that do not exist.
Hey, I am going to give them credit because as soon as this came out and it was dissected by the media and pointed out how many false citations and references that were used as to support this paper, they did go back and edit them out.
I mean, I guess give credit where credit is due, but to me, that is like wildly
Yes.
worrisome that
Well,
they even let a report go out that would not have passed muster from my kid's sixth grade science class, right? My
no.
kid just did a whole report on ancient Egypt and needed like five, respected
Yes. Resources.
references for
Yep.
their, and um, if a sixth grader can understand that, Encyclopedia Britannica is going to be better than some rando blog, then
Right.
I think that, a report coming from the federal government should be held to even higher standards than my sixth grader. Um, so
Well, good
that
luck with that.
the other thing is, we need high quality research that is published in peer
Hmm.
reviewed journals in uh, on this topic,
Yes. And
right?
RFK actually calls it we need fearless gold standard science.
Okay, fearless gold standard science. I am game for that. So
Yes.
for example, we'll get to this in another episode, but
Yeah.
one of the research reports cited by RFK Jr. in his anti-vaccine campaign or vaccine skeptic campaign is like a research article published by somebody on their own personal blog,
Yeah.
right? That was never in a peer-reviewed
It's
journal.
like
So
Dr.
here's
Mercola or whatever.
right. Now, the internet was supposed to be this great equalizer, right? That
Hmm.
anybody can write a blog, anybody can start a podcast, right, and get their voice out there. So I am not anti-personal blogs. I think there are some really well done blogs, Substacks, podcasts, etc.
Yeah.
Hopefully, we are one of them. Um, and there is certainly, I think, as two PhD students, we can commiserate with much of the academic, research community that there's problems in publishing, academic research publishing, right? There's issues.
Yes.
There's gatekeeping. Open access journals are, it's expensive. There's
Expensive. Yeah.
predatory journals. Like there's so many things we could talk about. But regardless, the system is important, and I'm going to explain why. Peer-reviewed journals means that when you submit your research article to a journal, okay, it gets reviewed by an editor and then sent out to peer reviewers, which are other researchers and academics in that field of study
Yes.
that review that article out of the goodness of their heart.
Yes. It
out
is
of
a volunteer position.
Yes, it out of what's called academic or research generosity, okay?
Hmm.
If we're all going to be trying to get our studies published, we need people to review them. So we should be reviewing in return, right? So it is an altruistic system. Yes,
In
publishers make
theory.
money, right? In theory. But I mean, generally speaking,
Yes.
just because a system needs reform doesn't mean all of it is terrible. So that's the
No,
first thing I want
definitely
people
not.
to understand. And when you review an article for a journal, you're looking at the quality of the science, right? Did
Hmm.
they, how did they explain their methods? Did they speak to reliability and trustworthiness or, what's called internal and external validity in certain types of research? Did they speak to how they are, what they're measuring, how they're measuring it? Are they measuring the right thing? What's their proof that they're measuring the right thing? They have to really display that in their manuscript. And it is subject to peer review from 2 to 6 peer reviewers
Hmm.
that will, you know, nicely or not so nicely rip apart your article for you and tell
Right.
you where you need to do better or, whatnot.
Right. Or
Um,
maybe they were like, you did all of the wrong calculations in your
sure,
statistics of your research. And
right.
so your conclusions are not accurate.
Exactly.
Yeah.
The other thing I want people to understand about peer-reviewed journals is that you have to disclose conflicts of interest and funding.
Mm,
So while, the MOCA report and RFK Jr. talks about how, industry funded studies, meaning, if, you are doing a study on the safety of a chemical and the study is funded by that chemical organization, right? Like that,
yes.
that company that makes that chemical, that is a conflict of interest, right? We
Yes.
need to be aware of that. And so peer reviewed journals, they require you to disclose that. That is something that, isn't
Right.
isn't hidden in peer-reviewed journals. Whereas, these other,
Predatory.
oh, yeah, predatory journals or you know,
Self-serving blogs.
exactly. They do not require that, right? The other thing I want to point out is this is important no matter, what space you're looking in, but whether it's a podcaster, a blog writer, whoever it is,
Yeah.
an expert on television or whatnot, if they're trying to sell you something, that is a red flag, right? So there is the, wellness movement, which is good. Nurses are all about wellness. We want people to, have skills and tools and education to live a healthy life. But then there's also something that's called like the predatory wellness movement. And
Mm,
that is, yes, we want you to be healthy and well, right? I'm an influencer on Instagram, so buy my elderberry syrup or buy my special cooking oil that isn't a
yep.
seed oil, or buy my supplement or buy my vitamin, right? And so, I'm not saying that those supplements and vitamins aren't good. I can't speak to that. I would have to do, look into it myself. I certainly take supplements and vitamins. I'm not saying I'm not against them entirely, but you do
Right.
have to be cautious, if the person that's telling you all about what's so bad about the food that you're eating, right, is also trying to sell you something or sell you some
Right.
type of, service
Yes.
or,
Right.
whatnot.
Like all that other stuff on the market is not good for you, but mine here is.
Exactly.
Yeah.
Exactly. I'm
Yeah.
not saying it's not good. I'm just saying be cautious, do your due diligence,
Yes.
think critically about it.
Hmm.
Because, they are preying on our insecurities and our desires to help our children be healthy, right?
Yeah. So
Um,
the, oh, I'm
yeah,
sorry.
go. No, go.
Well, I was going to say, and maybe this is where you were headed too, was one of the things that I have noticed, particularly in this section, was a lot of contradiction in the sense that they are saying we want all, we want to protect, we want to, make our children healthy again, right? Like all of their points to the bigger picture of this um paper. And then there was a statement in there, and I wish I wrote it down, but something to the effect of like we as Americans are not going to, you know, fall in line with the European Union way of doing things.
Hmm.
Um, because just historically, I can say I've noticed that the European Union is leaps and bounds ahead of the FDA here in
Hmm.
our country in terms of, being a little bit more forward and accepting some of the science where it isn't fueled by industry.
Right.
So there's less, I feel like, for instance, like some of like the food dye piece of things. Europe is kind of ahead on those things. Some of the other forever chemicals that we have in our cosmetics, um, that in Europe is, they've been working on that stuff for years, well beyond us. So there's mention in this MOCA report to not follow how Europeans do it. We're going to do it the American way.
Oh gosh, okay.
Okay, this is the message. We're doing it the American way. And one of the things being there is the reason for the criticism in the MOCA report is that they say the European Union's, equivalent um, to the FDA is too restrictive. Yet they want to go around and be even more restrictive on so many other things like vaccines and fluoride.
Yeah, I in general, I just feel like this report reads like I'm gonna give you what you want to hear, but I have no intention to actually make it come true. Like that to
Well,
me,
I think the way you make want to make it come true that is scientifically grounded.
yeah.
Yeah. I just feel like there's too much like like mutually contradictory agendas going on here. Like
Yeah,
there's their discussion of like we're exposed to too many chemicals, too many food dyes, too many ultra processed foods, too many pesticides. We need to do something about this. And then outside of Mocha, okay, that's great, right? Like, let's look at this, and that's what this paper is saying. And if you're looking at it just like in the silo of Mocha, okay, I'm on board, right?
hmm,
And then you look at all of the other things that are going on at a policy level
right.
federally. How do you support what Mocha is saying if that's truly what they mean?
Exactly. And that gets me actually to my next point, which is that if this MOCA report and the MAHA movement in general is calling for more research, right? Gold
Hmm.
standard, scientifically sound research, then why is the current administration cutting funding for research, right? So I just want people to understand what exactly the current administration is proposing to cut. Okay.
Yes.
So documents that were released in late May talk about details that the White House is asking Congress to make cuts to public health and biomedical research programs in the 2026 fiscal year that begins on October 1st. Okay. And so what they're asking for is the following. They want to, they're proposing cuts to the CDC, which again is the Centers for Disease Control. And
Yep.
if this whole MOCA and MAHA movement is all about saving Americans from chronic illness, I just want to point out that we're not going to make it to be old enough to get chronically ill if we die of infectious disease. Okay. So I
Right.
just like I want to be like
Yes.
very clear about
Oh,
that. And
yes.
I cannot fathom why we would as an American people, entertain cuts to the Centers for Disease Control when we are only 5 years out from the global pandemic that was COVID
Oh
19.
gosh.
Like,
Well,
if this
yeah.
was 2019, right? And the influenza of 1918 was 100 years ago, right?
Yep.
The influenza pandemic. And people are like complacent and, they're just like, oh, I don't understand what public health does because we're all so healthy. It's because when public health is doing its job, we don't realize it because nobody's getting sick,
Exactly.
right? Um, it's like the most thankless job
It's
in
like,
the
oh
government.
yeah, it's like the misunderstanding of like, why do I need this MMR vaccine, measles, mumps, rubella, because nobody has it anymore. Well, guess
Right.
what?
Right, exactly. So I just want, we really can't be dying of infectious disease, which is
Yes.
if we want to live to even suffer from chronic illness.
Yeah,
So that's one
yes.
thing
Come
I
on,
want to
I want
point.
to suffer from my chronic illness in old age.
Um, so in the CDC budget um, cutting, they want to eliminate $1.4 billion from the CDC's Chronic Disease Center.
God.
So that's
Yeah.
against what this report is saying. So that's the current budget that's being proposed. Okay.
Yeah.
Um, Another thing I want to point out is that this budget proposal from the White House it is proposing cuts to the National Institutes of Health by about 40%.
Now you're
So
referring to the One Big Beautiful Bill Act. Is that correct? Is that where these funding cuts are referenced?
yes.
Yes.
Okay. So
Okay.
they also want to reorganize the National Institutes of Health, and they want to preserve the National Institute of Allergy and Infectious Disease, the National Institute on Aging, the National Institute of General Medical Sciences, and the National Cancer Institute. Those are good. Okay, good. But they want to eliminate institutes studying minority health,
Yep.
alternative medicine, which is something that I thought this movement
Liked. They
liked,
embraced.
the National Institute of Nursing Research,
Oh, I
and global
know.
health. So that is incredibly concerning to me. Again, you're talking out of both sides of your mouth. If you're saying you want
Yes.
more research into this, but you're going to cut,
Yes.
research in these other ways.
It's so
Um,
disingenuous.
yeah,
Yeah.
and you know, I I also want to acknowledge that one of the things RFK Jr. Is proposing is like more studies confirming things we already know. And a way to describe that is called replication research, right? So, like, if we get one study that says this is the way to do X, Y, and Z, sometimes professional organizations just run with that and say, oh, we've got this one really good, high quality study,
Right.
let's go for it. And then that's at the expense of like replicating that study in other populations or whatnot. And that is a valid criticism, right?
Hmm.
I, for one, am not alone as, nurse researchers saying we need more replication studies. So that is true. However, there are some things that we have so much research on, and this report is proposing to just continue pouring money into things that we actually have decades and decades of research on already. So
Right.
I think they're using this very reasonable criticism of the scientific community that we need more replication studies, right? Um, by by saying, oh, yeah, we need more replication studies, but actually the studies that we're going to prioritize are ones that we actually don't need to replicate anymore.
Right.
So it's
Right.
like, again, talking out of both sides here.
Yeah, exactly. The other, piece I think that they're trying to embrace and say like the scientific community, because okay, let me back this up for a minute because this triggered a thought that RFK Jr. Had put out some memo within the NIH that NIH researchers can no longer publish their research findings in like peer-reviewed journals. Do you remember reading this? It was probably in the last month. And the tactic of bombarding us with so many headlines of their changes by Steve Bannon
Hmm.
works because then you get so fuddled with when was this, what was that, and this is one of those things. So it made me think of like, wait a minute, didn't RFK say like now that anybody uh, at the NIH doing research can no longer publish their research in like mainstream journals. So like if it was something that would be, worthwhile in JAMA or New England Journal of Medicine, some of the biggest and most, accepted scientific journals,
Hmm.
medical journals. Um, he says, no, we can't do that because their system is biased.
Right.
I don't know where I was going with this point other than like all about this research. I was just like, wait a minute. Like he's where are we going to be where is this where does he want this research, this fearless gold standard science to be published?
Right. If what he's proposing is, making it more publicly available to consumers of healthcare, like everyday Americans, because again, one of the criticisms of the current scientific publishing, journal system is that many of these articles are behind paywalls unless you spend lots and
Mm,
lots of money to, be a member of these professional organizations, which most everyday Americans are not going to fork over hundreds
right,
of dollars a year to be part of, the American Medical Association so they can subscribe to that journal, right? They're not going to pay
right.
$40 per research article on PubMed. Um, if what they want to do is, publish this publicly, that's great, but it still needs to go through the same rigorous
Yes,
process of peer review and financial and conflict of interest disclosure. And
right,
I just don't see that happening.
right.
I can't predict the future, but if what they're going to do is just publish whatever the hell they want, vetted by nobody, into the ethos, that's
Mhm,
not any better. Like you can't just
right.
throw the whole system out. Yes, yes, the current, academic publishing system has issues, but one of the things that they do well is peer review and require disclosures for conflicts of interest and funding. And if you're not going to uphold that, then you're no better.
Yeah. And I think that also, reminds me of the fact that like there's so many cuts to NIH. And NIH, the National Institutes of Health, does fund a lot of research across the country, um, at different academic medical centers, research centers. So it isn't just like, in their own location that they're doing this, but that comes through grant funding, and that grant funding is all getting cut.
Right.
And the other thing is historically, I don't know if this is officially changed given what RFK says about where you can publish if you have NIH research
Hmm.
based or funding or yeah,
Funding for your
funding.
research from the NIH. Yep.
You can't publish in, these traditional peer-reviewed journals. We like now there's like the can you tell I'm just so like I can't wrap my
Flabbergasted.
head around it because I'm just like, wait a minute, you're telling me that we're you're going to take away money that funds this research that is considered unbiased. So like NIH funding is
Hmm.
considered like a non-industry funded
Right.
research arm, basically. But you're going to cut that.
So where are people going to go to fund their research?
Exactly. Well, and guess what? Industry. Because now who's going to swoop in and say, I'll give you the money?
Yeah.
Because why the heck not? Now they can, have a better chance of having their industry-based product tested, thinking that it was all, unbiased and whatever. I don't know, it's just mind-blowing to me, I guess.
Yeah. Yeah.
Yeah.
Another part of this, tenet of the MOCA report is limiting microplastics in our food and the
Mm,
environment. So, you know, microplastics leach into our food through, like, again, plastic packaging, microwaving food in plastic
yep.
containers, storing food in plastic containers, processing of food, et cetera, et
Right.
cetera, et cetera, right?
Yes.
The MOCA report says they want to limit microplastics in our food and the environment. The scientific community says this is something that is worth doing. Yes, microplastics are a problem. We don't even
Yes.
fully know how much of a problem they are, right? So the
Hmm.
scientific community agrees. What is this going to take, though? Okay. So what is it going to take? It's actually going to take taking on fossil fuel companies.
Yes.
So just use, think about that for a minute and think about how if the, you know, MAHA movement that is supposedly being supported by this current administration wants to do something that requires taking on fossil fuel companies, where this administration is saying things like drill, baby, drill. How is that actually going to happen? Don't piss on my leg and tell me it's raining, right? Judge Judy, I didn't make that up. But like,
That's great.
what is it going to take to limit microplastics? What it's actually going to take isn't just saying, I want to limit microplastics. Okay.
Right.
That's just talk. What it's actually going to take is supporting legislation and policies that advocate for regulating plastic production, which comes from oil, and reducing our reliance on fossil fuels. Limiting microplastics in our food comes from supporting stricter regulations, pushing for measures that limit plastic production and waste, right? The
Yes.
recycling, if anybody's looked into like the history of plastic recycling in this United States, it's really mind-blowing how it was basically a campaign from fossil fuel companies
Yes.
to make it seem like plastic recycling was something that actually happened and could be
Well,
done.
and it was the fix to the problem.
Right, right. We're gonna
Yes.
pump all this plastic into your food and your environment and your clothes and your everything, right?
But it's okay because you can recycle it.
It's okay because we can recycle it, whereas most plastic is never recycled. Plastic that is recycled, most of it cannot be recycled and is just landfilled. So it
I do
was,
have to admit though on this, Melissa, I have a hard time letting it go on recycling. Like I
oh yeah, no,
that
I'm
camp
still
that
recycling.
campaign, I know that campaign worked hard for me.
It
I mean,
did.
they
Captain
had it on
Flynn
the
in the 80s
yes, they
absolutely
had
worked
it on
on
the
me.
Golden Girls. It was like a whole episode like where they all decided to recycle and like they had their recycle bins. Do you remember this?
Hmm.
Um I don't remember the
Very
specific
well.
episode, but I'm sure Blanche was dating somebody that also like, and then there was like hijinks between Rose and the recycling. I don't know, but like I bought in hard.
Yes, and I do. I'm not telling people don't recycle. What I'm
Yes.
saying is if we actually want to limit plastic in our environment, the most effective way to do that is not putting so much plastic into our system to begin with.
Yes.
Right. And
Yeah.
so, yes, people need to do their everyday part to, limit single use plastic containers and use their reusable water bottles and coffee cups and all of that.
Yeah.
That's important. That does something. But the biggest thing we can do is support legislation and policy that
Yes.
limits plastic production and waste, that makes people not package everything in plastic, right? So that it doesn't even come to the consumer in the first place,
Right.
right? We also need to support renewable energy initiatives. And you also, for the record, can't cut funding to the Environmental Protection Agency if you are saying you care about
Yes.
limiting pollution in our environment,
Oh,
right?
I
Again, this
know.
is talking out of both sides of your mouth. You
Yes.
can't, on the one hand, say we are serious about limiting microplastics in our food and environment. Because guess what? Families are counting on you to do what you're saying. Okay. They believe you, they want that done. And there's good scientific consensus that says we should be doing this, right?
Yeah.
There isn't some conspiracy in the scientific community against limiting microplastics. That is fear based propaganda. Pretty
I
much
do have to say, I've
everybody's
not
on
heard
board.
any of that at all, actually.
Heard
Of
any of
all the
what?
conspiracy theories that could be out there, I have yet to hear anything about plastic.
Well, you can't cut the EPA. You can't cut, you
Oh
know,
yeah, no, I'm not making that argument. No, I'm just saying like I'm thinking about of all the conspiracy because I mean you hear all sorts of things about fluoride. I don't know why fluoride is such a big focus, but that's another problem. We
yeah.
can discuss it another time.
To me, it's just, this budget proposal from the White House wants to cut EPA employees. It wants to slash the agency's funding by, almost half. Like
Yeah,
it's wild to me that how are you going to do this if you're slashing EPA funding,
right.
right?
The other thing too that we have not talked on, I think we talked about this quite a bit in our previous episode, is the social determinants of health piece.
Yes.
And all of these things of like, hey, let's reduce our pesticide burden, our plastics burden, et cetera, et cetera. There are ways people can do individually,
Hmm.
but right now that takes money
Right.
and resources, which are on, are burdened to the individual. And if you are in a socioeconomically privileged position,
Hmm.
you can do some of these things, like to decrease your own burden and your children's burden of exposures. So when you're talking out of both sides of your mouth on this issue, what you're essentially saying is this is what is best, we feel, from
Hmm.
our standpoint, and good luck to all of you who can't manage it on your own,
Exactly.
because we are going to make it even harder to have that possible. We're going to cut your SNAP and your WIC benefits. So, over the years, SNAP, for instance, otherwise known as like food stamps, for instance,
Exactly. Right.
um, they did start to allow for fresh fruits and veggies. And you're going to now cut all that to people?
Right. Exactly.
It's like, uh, yeah.
And reasons why areas where there's higher levels of poverty are more exposed to things like air and water pollution is directly related to policy, right? We
Yes.
say these things shouldn't be political, but they are political because it's political policy that has made that the way it is. It's not by accident, it's by design. The interstate highway system, the Eisenhower interstate highway
Mm,
system, where did they build these highways? Through the poorest neighborhoods.
hmm.
Where do you have the biggest exposure to air pollution? In places where you're 100 feet from a highway, right?
Yep.
Where are people children disproportionately affected by things like asthma, which is not, some silly little illness. It is a life-threatening chronic
Yes.
illness. Asthma is a big deal. People don't
People
think they think
die.
it's just a couple puffs of an inhaler, but it's
Right.
not.
People
It's
can
a
die
it's
of
a
asthma.
exactly, it's a serious reactive airway disease that requires health care to manage and medications to manage. And those children living in those poor communities that are by design more exposed to pollution are the ones disproportionately affected by that. So, you know, we can't cut funding into social determinants of health, right? Which is what is social determinants of health? We know that there's lots of things that affect our health, right? There's biological determinants of health, my genetic makeup, my
Yep.
family history, right? But there's also things like social determinants of health, which is, your financial resources, the environment in which you live, work, and play, right? Et cetera, et cetera. If when you cut funding into social determinants of health, what this administration is calling that is DEI, right? Which is diversity, equity, and inclusion, which
Yeah.
shouldn't be this like awful word that everybody
Right.
seems to hate. Because what it's saying is, that we're not a monolith, that we are a diverse country, which we are.
Oh, yeah.
And when you're cutting funding to quote DEI, which has just become this political buzzword and this political
Right.
dumping ground, you're actually cutting funding into social determinants of health,
Hmm.
right? And that's a real big problem if we're actually trying to make America's children healthy again.
Exactly. I,
Any
I,
last thoughts, Jamie?
I, um, I think that we are going to notice a trend when we, go through the rest of these tenets of this MOCA report. Um, but I think at this point, um, I'm skeptical of where this will head or land, as much as I want to be um, hopeful that the action plan is going to be doable, realistic, and equitable.
Hmm.
Yeah.
I think I have kind of two takeaways from this. One is if you support this tenet of the Make Our Children Healthy Again report, limiting your child's exposure, and like you said, all of our exposures to forever plastics, forever chemicals, microplastics, heavy metals, pesticides, food dyes, whatever it may be, then you can't support the White House's proposed budget for the next fiscal year. You can't support it because it's cutting everything that could make those things come true. All right. So keep that in mind. My second take home is I hope, they claim they're going to have a another report coming out in August that is an action plan to make this MOCA report come true. And I hope part of it is funding, public health funding for education and tools to limit children's exposure to these chemicals. So, for example, I would love to see funding for families to purchase HEPA filters, air filters for their home, or reverse osmosis water
Mm,
filters for homes that have
yes.
wells, right? I would love to see a public health campaign that provided funding to help people get the money or to test their wells. Because well testing, I know in Massachusetts isn't required. You're not required to test your well water every year. I do test my well water every year because the town I live in actually happens to have a PFAS problem. And
Oh, it does.
it's
Mm,
hundreds of dollars a year for me to test my well water. It's a huge blow to my wallet every time I test it. And I do it because, I know how important it is, but there are a lot of people who don't have the money for that extra expense. So that would be something that I could see actually making a difference. If they want this to come true, right? I would love to see funding for people to purchase fresh fruits and vegetables and education on how we can make different choices in what we buy to limit our exposure to things like pesticides. For example, some of you might have heard about like the Dirty Dozen and the Clean 15. These are some
yes.
like general guidelines about like, okay, what foods are the most important to buy organic? It might be things like strawberries because it has a thin skin, they're close to the ground, and you eat the whole fruit. Whereas you don't have to splurge on organic bananas because they have such a thick skin that you're really not getting that much exposure to pesticides if you buy conventional bananas, right? So that type of education on like how can you make your dollar stretch farther, what foods might be more important to buy organic or not, whatnot, money towards uh, SNAP benefits, EBT, food stamps to locals farmers markets, right? We need
Hmm.
less preservatives in our food if they're bought locally, right? So
Yeah.
I would love to see that. And if the report in August comes out with support for those types of things, then I can really get on board. But if it doesn't, then it's just lip service. And lip service isn't going to make our children healthy again.
Yeah.
All right. Well, that wraps up episode 2 of our Make Our Children Healthy Again, What Nurses Want You to Know. Thanks
Yes.
for everybody for tuning in today.
Yes. And for more resources and information, make sure to head over to our Substack, which is at Nursing the Nation, for our show notes and references as well. Make sure that you subscribe to our podcast on your favorite podcast app and write us a 5-star review.
And share
Share
this
us.
episode with a family or friend.
All right. So until next time, we'll
Yes.
see
Goodbye,
you.
everyone.
Bye. Thanks for joining us on Nursing the Nation, where we discuss the headlines and current events through a nursing perspective. Remember to follow us on your favorite podcast app, leave us a review, and share this episode with someone who needs a nurse's take on the nation. Nursing the Nation is hosted by Jamie Bourgeois and Melissa Ann Dubois. Topic research is done by Jamie and Melissa. Editing is done by Jamie. Music is by Magnus Moon. Head over to our Substack at Nursing the Nation for detailed show notes. We speak from the experiences and expertise of being nurses, but the opinions on this podcast are our own and not representative of any employer, institution, or organization we may be affiliated with. Thanks for listening, and please follow our socials.